Oldham County students are getting hands-on experience in the hospital through a partnership with UofL Health.
WDRB's Christy Batista spent the morning with them as they shadowed neurosurgeons.
Many x-rays.
For doctors at UofL Health, it's just an average day of surgery.
Down here, they're going to be like this big.
Oh, wow. But this Friday, they have two special guests in the operating room with them.
I think that's really cool how the fat is different from the muscle.
Andrew Garrett and Biz Gold are getting a first-hand look at what it's like in the OR with Dr. Emily C.
Kind of triangle-looking one here.
Okay.
So sacrum, 5, 4, 3.
The director of neurotrauma at UofL Hospital.
I never got into an OR until I was a medical student. And two of the students were like, oh my gosh, this is so great. And the resident and I who were doing the case looked at each other and we were like, well, we do this every day and sometimes we forget how amazing what we do is. And it's nice to have that perspective and see through fresh eyes how truly amazing medicine really is.
When they're not shadowing doctors, the students go to Oldham County high schools. Students can apply to go to the Arvin Center for a third of their school day, and there they have 8 different programs giving them hands-on experience in the real world.
It's just wild. Like the level of trust that they're giving to us to be like in there in a room that is like sterile with actual surgeries going on. And they're just like, yeah, you can watch and it's going to be awesome, but like don't get too close. It's like, wow, this is real. This is great.
These seniors in high school are in the Biomedical Academy. And it's not just shadowing the doctors.
If I was to do a cervical exam before knowing this, I could kill a patient.
Upstairs in labor and delivery,
don't they check to see if it's like anterior or posterior, like positioning?
Nora Weatherton gets a look at a patient's ultrasound and learns why it's important for a future mom. Real life experience, so they get an idea of how they want to spend the rest of their lives.
I've learned a lot. I learned that surgical oncology is not for me because I got really connected to the patients and that was really hard to say goodbye. But going to NICU, I learned a lot about how you can make the difference.
Helping people. Reporting with photojournalist Dave White.
Is there a specific kind of section that you're using?
Christy Batista, WDRB News.